Hello, everyone. Welcome. Welcome to our 12th episode of Data Talks, a series of free 45-minute webinars about using local data to inform housing policy. My name is Claudia Aiken. I'm Director of New Research Partnerships here at the Housing Solutions Lab. And this episode will explore using survey, interview, and administrative data to understand home repair needs, to design effective home repair programs, and to study the impact of these investments. So I'm really delighted to be joined by my colleague, Tony Bodalovich, who's a data and policy analyst here at the lab and a driving force, as you know, behind this series. He will be moderating the Q&A portion today, and we're also just so excited to have joining us Cypress Marrs and Sarah Curry, researchers at the Housing Initiative at Penn, and Dan Sullivan, who is Housing Stabilization Program Manager at Action Housing in Allegheny County, Pennsylvania. With support from the lab, Cypress and Sarah have done an in-depth study of Action's whole home repair program, and we're going to hear much more about that today. I will start things off with a very brief introduction to the lab and to the series. Cypress and Sarah will then give a presentation about their study and what data can tell us about designing home repair programs. Then we'll pull in Dan for a conversation about how Action Housing designed and implemented their very data-driven program and how Cypress and Sarah's findings can inform the work going forward. And finally, we will have 10 to 15 minutes for your questions. So please feel free to submit those via the Q&A function at any time during the session, and we'll get to as many of them as we can. So if you're not familiar with the Housing Solutions Lab, we are based at the NYU Furman Center. Our mission is to help small and mid-sized cities especially plan, launch, and evaluate housing policies with the goal of advancing racial equity, health, and well-being. So thank you so much for joining us today. I hope you'll take the opportunity to view past episodes on our website as well as register for upcoming ones. Each of these sessions features a fireside chat with someone like Dan who has that experience on the ground. We also like to post recommended reading, so definitely check that out, and I'll drop the link in the chat in just a sec. But for now, I am going to turn it over to Cypress and Sarah for their presentation.
Much for that, Claudia. Just a second to share screen. Great. So I'm Cypress, and I'm so happy to be presenting this work that we did studying the whole homes repair program in Allegheny County. This is work I did alongside Sarah Curry, who was a research assistant and has come on board as our housing project coordinator. And I've done this work at the Housing Initiative at Penn, which is a small little team out of the University of Pennsylvania. And we partner with state and local government to design and research more equitable solutions to housing policy. This work was done also with the support of the Housing Solutions Lab and of Claudia, and have been so grateful for our partnership with Dan. So just like a little bit of background about home repair needs, right? There's been work out of the Federal Reserve Bank of Philadelphia estimating that there's as much as 2.225 billion dollars of outstanding home repair needs. There's reason to think that those costs and there's like particularly acute need in Pennsylvania where we are. It has some of the oldest housing stock in the nation. And with aging houses are often like a naturally occurring source of affordable housing, right? And these homes are becoming increasingly uninhabitable. And then finally, right, people can get turned away from existing programs like the weatherization and assistance programs because their homes need more significant repairs than can be made through those programs. And so into this space came the whole home repair program. And so in 2023, the Commonwealth allocated over 100 million to fund repair programs and promote workforce development. About 13 million was allocated to Allegheny County, and just under 9 million was spent on repairs. Action Housing was the primary grantee. They processed applications and worked with contractors to make repairs to grantees' homes. Just a tiny bit of context about Allegheny, right? It's in the southeastern portion of the state. The median year of home construction is 1957. And there's over 100,000 homeowning households below 80% AMI, which was the threshold for eligibility for the program. We were really lucky to partner with Action Housing to conduct a case study of the impact of the whole home repair program. Our research draws on program data, so several times they gave us cuts of their administrative database, surveys of program applicants, and interviews with households that received repair, and then throughout Action Housing provide really useful context on program implementation. So I'm going to pass it over to Sarah for some findings, and then she'll pass it back to me for some lessons learned.
Great. Thanks, Cypress. So over 4,000 households applied for the program, and on average, these folks were living in homes that were even older, about 30 years older than the average home age in Allegheny County at large. And over the course of the program, 250 homes received repairs, so you can tell that the program was really oversubscribed and deeply needed. In a survey taken by program applicants, about 3 of every 4 households said that they had exposed wires, had difficulty heating or cooling their home, had pests and rodents. 50% of respondents had peeling paint, and many had issues with water damage as well. We had also asked respondents what aspects of their life were affected by the quality of their home, and if they were attempting to make repairs, and if so, to what extent. And what we found is that even though these housing quality issues are affecting people's finances, their mental health, their ability to sleep, people are coping with these dangerous conditions by simply living alongside them. It's summed up very succinctly in this quote from Lisa, who we interviewed. She said, "On my list, I had the easy things. The hard things and the dangerous things, they seemed way out of control, too expensive. I thought, well, maybe if I hit the lottery, that could get fixed." And Lisa's sentiments are backed up by HMDA data, which shows that very few homeowners with the lowest incomes in Allegheny County even apply for home improvement loans. And when they do apply, only 25% of those households have loans originated to them. These are some of the other takeaways from our survey, where we found that those who did find ways to make needed repairs were doing so in a piecemeal way or were relying on family and friends. And this chart really exemplifies the work that was able to be done through the Whole Homes Repair Program and the work that was needed by those 250 households who were served. On average, a home received repairs that fell under at least 3 of these different categories, with roof damage being the most needed repair. So, what was the effect of these repairs? In interviews, many homeowners expressed that their stress levels had greatly decreased. Rooms and basements that had previously been blocked by lack of repair were now able to be accessed more fully. Interviewees reported that they were more optimistic about being able to remain in their homes with their loved ones, and to quote Sandra, it absolutely changed our lives in every regard. Back to you, Cypress.
Thanks, Sarah. Right. So, what are our findings, our lessons, our takeaways? The first, right, is that home repairs address health hazards and improve well-being, right? Having the repair issues resolved in exactly the way Sarah just laid out often had really direct impacts on how residents used their homes. It was useful for us to have specific and standardized records about what types of repairs were being made in various homes to really understand the impact the program was making. And then we also had found it really useful to ask in our survey directly about what areas of life were being impacted by outstanding repair issues. Another finding is that the full extent of repair needs is often difficult for homeowners to assess. So one thing that we found both through our interviews and our conversations with Action Housing was that oftentimes the issues that applicants were citing in their application didn't really fully encompass their need, right? So it maybe was there's a hole in my ceiling that needs to get fixed, but that was downstream of a roof repair issue. Um, and this has like in our minds two really clear implications. The first being, right, is that the current national estimates of home repair needs are best based on self-reported need in the American Housing Survey. And so uh, given what we found and saw about homeowners not being able to fully assess what their needs were, these estimates are likely vastly underestimating the true scope of the need. And then our second sort of like finding or suggestion here, right, is that program processes, particularly those involved prioritizing applications and establishing scopes of work, should be built with this in mind. Because, right, different homeowners sort of come with different amounts of knowledge, and there can be really clear issues around equity. And then a third, right, is that home repair programs are an opportunity to conduct inspections and learn more about what need looks like in a community. Um, Home repair programs, right, require hands-on coordination. Through interviews, right, we were able to sort of understand ways in which program applicants and program participants were not always super clear on what a program's priorities were. And so to really ensure that positive experience with the program, specifically in cases where the repairs a program can make or are prioritizing are different than what a homeowner would prioritize, having really clear communication and hands-on coordination is important. This also extends to facilitating productive and safe working relationships between homeowners and contractors. And we really just emphasize the fact that this requires like staff time, expertise, and capacity, and that function needs to be funded as part of these programs. Finally, right, continuity in programs strengthens processes. So we had the opportunity to do interviews with program participants that got repairs more early on in the program and later. And it was really clear, right, that there was a lot of learning, right, that happened by the program in terms of improving some of those processes and those communications. And then just really emphasizing the extent to which meeting current repair needs and building strong programs is going to require ongoing and sustained investment. And that's it.
Thank you so much. And really, that just covered the very top of the iceberg in terms of your study. So I've just posted a link in the chat where folks can learn more. It was such a wealth of information that HIP collected. And I'm really grateful to you all for sharing today. Now I'd love to have more of a conversation. Um, I've seen some activity in the Q&A already. Please continue to drop your questions in. We will be getting to them in just a little while. But for now, Dan, if I could, I'd like to start with a question for you.
Sure. Just to introduce myself, I'm Dan Sullivan. I'm the Housing Stabilization Program Manager for Action Housing located in Pittsburgh, PA. For the purposes of this discussion, I was also the project manager and the project manager for Allegheny County's whole home repair program.
Perfect. Thank you so much. And so part of standing up a program like this involves setting eligibility standards and really selecting the homeowners who get to participate. So I'd love to know a little bit more about how you all approached that, what data you used, and were there real gaps in the data that were challenging?
So what we did, one of the great things about this program is that when it was federally funded, it ran through the U.S. Treasury Department, an entity that typically at the federal level doesn't put a ton of restrictions, needless restrictions, on programs like this. So when we got the money, we were able to really sit down and think about like, what were the problems that we have seen in these types of programs before? Action Housing runs Allegheny County and Greene and Washington County's weatherization programs. So we're used to programs like this. And our biggest thing was we started looking at some data maps, in particular, like low income census tracts, majority minority home ownership census tracts, and compared them to data that we had on who has received weatherization or received an accessible modification program, and they didn't line up, right? So, we were tasked by Treasury and the Pennsylvania Department of Economic Development to like create a program that really did address that, like really did focus in on those least served but most in need. So when we put together the application portal and try to create the process of how folks were going to get selected, that was the driving factor. Everything that we did was trying to accomplish the goal that we were going to work in communities that we know are getting passed by. Pittsburgh is like one of America's smallest big cities. Like we all know the data maps. Most Allegheny County folks are from Allegheny County, multi-generational. We know where the problems are. We just needed data to reinforce it, to justify it back to Treasury, which we did. We had already had an application system that was created between us and the Allegheny County Department of Human Services during COVID for eviction prevention, rental relief. So there was a platform that was already built, and we just went back to the county and was like, can we take this and sort of change it up for a home repair program and run a separate database and application portal for not just this program, but any home repair program that Action Housing takes on moving forward. We wanted to give it the sort of ability to be flexible with different program parameters, dollar amounts, needs and locations and things of that nature. So it took months, many months, a lot of conversations between us, Deloitte, who built the database, County DHS, Stanford University, who helped us put it together, to create a system in which we open up the application portal for a set period of time. Typically, it's like 30 days. Right? We do not have to advertise this program. The first time we opened it up, we got well over 4,000 applications in 30 days. Right, so we really don't need a whole lot of press on this. We then close it and begin a randomization process of the clients in the system. So everyone has some level of chance of being randomly selected for work to be done. But because we received so many applications, I think on average, we only probably worked on like 4 to 5% of the homes that were in our portals. So what we did was then we added these weights to the randomization for each homeowner based on things like, are you in a low income census tract? Are you in a minority majority home ownership census tract? Do you have children who have elevated blood lead levels? Are you a senior? Do you need accessible modifications to stay in place? Because those are the target communities that we were looking for. So when we would then pull, let's say 100 clients who we're going to begin working on, right? It did focus a little more on those types of clients because that is the market that we were trying to hit. And all of our data shows that we were very successful in doing that. We were working in communities that have long suffered since the 60s and 70s in Allegheny with the close of the steel mills that I know just continue to get bypassed over and over and over again. And we did a ton of work in those communities. And it is a sense of pride of not just me, but the entire team that we were able to do that. It was a very different process. Most folks who run these programs have wait lists. It's a first come, first serve. We didn't do it that way. It was all those things just are not equitable, right? Whether it's a tech issue or a mental health issue or things of that nature. We did away with paper applications, which was a bit of a point of concern from some entities. But what we did to make up for that was we opened up walk-in centers with laptop kiosks where people could put in their information and submit an application. Also, and this is big, I think from a time saver perspective for both clients and action staff, is that everything was a self-attestation for the initial application. You did not have to submit any documentation. You just fill it all out, click a bunch of buttons. The application takes like 10 minutes. You're done. After the randomization, if you are then selected, we will contact you to find the supporting documentation. Also, a lot of things that other counties do, like requiring deeds, we didn't have to require a deed because our real estate portal in Allegheny County can verify ownership, things of that nature.
Oh,
Right.
wow.
We didn't get too Yeah, we didn't get too obsessed with like chain of title stuff. This Allegheny County's got this. We have a very old population. You have a lot of people living in homes that they don't technically own, right? But we still worked on those homes, right? Because if they were residents and you could prove the mom and dad had passed away, and you are next of kin heir, just a chain of title, we'll still work on your house, right? Because you shouldn't be punished just because you don't make enough money to hire an attorney to open and probate an estate, right? So that's kind of how we try to make it as fair as humanly possible and as easy as possible, both for the applicants and the staff. These programs can get very burdensome on paperwork, and we are trying to restrict that as much as possible. I think initially the data points that we collected were pretty useful. Certainly, we are constantly looking at making changes to the database. Funding is always sort of a problem to pay for that. There were some things that we missed, like we weren't tracking per project breakdown. So if you had a roof and electrical and some like flooring that needed done, the scope will have that breakdown, but we didn't enter it into the system.
Uh-huh.
So if a contractor paid $45,000, it was the 45,000. It wasn't 20 for the roof and 15 for this, and so on. And I think we could do a better job of catching that. We kicked this off without, I think, a lot of planning for the energy efficiency stuff. So we didn't collect, 3 months before, 3 months after in terms of utility bills, which is
Oh,
something we're going to be doing moving
interesting.
forward.
Yeah.
Yeah, that is really important because now what we're doing is we have to go in these homes. We'd like to and do energy efficiency work, right? And do those calculations to make sure that square footage and the ductwork is right, and then come in and if they want heat pumps, if they want solar panels and stuff like that, we want to be able to do it. But we don't have documentation on utility bills to show like what kind of utility poverty are they actually suffering? Like, is how expensive is the housing actually outside of like the mortgage, right? Um,
Gotcha. Well, I'm going to
but we're
stop you
aware.
there. I really
Yeah.
appreciate all the detail. And these are exactly the questions that come up for us at the lab. We have organized two cohorts of cities who are interested in strengthening their home repair programs at this point, and exactly these questions about how you target a program that is so vastly oversubscribed come up all the time. But I want to turn to Cypress now. Your team worked to embed a survey in the program application to learn more about housing conditions, quality of life. Can you tell us more about that kind of data collection approach and what you learned?
Yeah. So, um, maybe just a little bit of background. When you're saying embed a survey, right? What it is after someone submits an application, they're invited to take a survey. And so it's directly embedded in the process, although it's not actually part of the application. The application is quite streamlined as Dan laid out. And so I just want to draw that distinction. Initially, when we scoped out this project, we had been hoping to do two rounds of surveys, one round of surveys at the beginning when people applied, and then another following up with those folks um, after the program was done, and so that we could compare households that had received repairs and households that didn't. 300 households took our survey, but the program was so oversubscribed um, that of the 300, something like 8 of those people had received repairs through the program. And so at that point, we decided to switch and do interviews to sort of understand impact there. We're really glad we still did those baseline surveys though, because I think it gave us a great sense of overall like need and housing condition. As well as like how people are coping absent repairs and just like gave a lot more texture about what need looks like in Allegheny County. One of the questions that Sarah and I worked to put together that I haven't seen other research teams use is asking people really explicitly, okay, what specific factors of your life are being impacted by these outstanding repair needs? Um, and we've been really happy with how that allows us to do some storytelling around what need looks like more broadly and get at the ways in which outstanding repair issues that folks really can't afford to make impact their ability to just do some of the really basic the basic things that a home is for, right? Like cooking, getting in and out of their house. It's impacting people's sleep. And so we're just really, really grateful for that, as well as sort of understanding how people are sort of doing this sort of like piecemeal approach, relying on friends and families to make really like sort of I think calling them repairs is generous, right? Like jerry-rigging solutions so that they can keep living in their homes.
Right. Yeah, I also found that very powerful. And so you mentioned that you ended up turning to interviews. And so I'd like to ask you, Sarah, if you could tell us a little bit more about how actually speaking with repair recipients deepened your understanding of the program.
Of course. Right. And just like Cypress was saying, because the interviews took place after the repairs, we got a more sort of like rounded out deep dive on how recipients experienced the program from prior to application all the way through to how they were living at the time that we were speaking with them. And for most of the interviewees, or for a handful, we were able to ask folks questions if they had not taken the survey, some of those questions that had been included in the survey. Um, I also wanted to also mention that, like Cypress was saying during the presentation, homeowners aren't always able to self-report the extent of the repairs that are needed. And so interviewing them and giving them time to really describe the full extent of the repair and how it's changed after it's made, just I think gave people more time to think out loud about how the issue is really affecting them. And one particular interview comes to mind where they were describing how prior to the repairs, they could never park right next to their house because the driveway was so cracked at the part closest to their home. And additionally, lights and outlets in their home just didn't work and they just knew not to use those. They would turn on a microwave and the light sometimes, and the fuse box would cut. And so, and half of the breakers, would fuse out. And so those are things that we might not have known so specifically with just the survey. And through the program, they had those outlets replaced, their electrical box was rewired. That particular homeowner also had a roof replacement and a kitchen sink, got some plumbing. And so at the end of it all, they were just describing to us there were things that they wouldn't even have asked for. And again, that just never would have come up in the survey. This particular homeowner was really glad that they wouldn't have to worry about their home catching fire. And so beyond that mental stress and beyond that fear being eased, I mean, obviously that's life-saving.
Yes. Oh my gosh. Another thing that I thought was really interesting from the interviews was kind of learning about the relationship between the participant and the contractor, and some of the issues that arose. Dan, I'd like to ask you actually about that aspect of managing contractors and keeping homeowners informed. I know that can be challenging and would love to know a little bit more about how you all handled that, and how you tried to build trust.
Yeah, there's two possible problems in my day-to-day work experience. One is the homeowner, the other one is the contractor. Um, we were quite clear with every level of participant, right? The contractor and the homeowner, or if they had an advocate, speaking with them and being like, this is a program that does health and sustainability issues. These are the repairs that we are doing. It is not it's not a move that van kind of thing where like we're going to remodel your house, right? We're going to take a look at things that will possibly keep you from living here as long as you want to live here. And so there was a lot of tough conversations with homeowners to be like, they wanted cabinets. Like, we're not going to do cabinets. I'm sorry. There was a lot of times where like we didn't run up to the max of $50,000. They maybe had like 5 grand left, and they're like, "Well, you can give me the 5 grand for something," and be like, "Again, we can't make these exceptions because it's not within the parameters of what the program actually does." Right? In most cases, while I know a lot of homeowners were upset about it, it did stop most of them from signing the contract to get the work done. Right? I think off the top of my head, I only had maybe one or two who like fought us so hard on something that we were just like, well, we can't do the work, unfortunately, right? So it's a pretty good percentage. The other one is like making sure that the contractor understands what that scope is and they stick to that scope. So we are part of the initial inspection. We are part of the finals. We try to do some level of QC, but these projects turn around pretty quickly. Um, one of the things that you routinely see in programs like this is the homeowner then gets the contractor and they're like, well, I want to do this. And the contractor's like, yeah, sure, we'll do it. It happened a bit. I'm not going to say it didn't. But that's a cost then that the contractor's going to have to eat. We tell the homeowner up front, like, if you have the contractor do something outside the scope, you're going to have to pay for that. That is not covered here unless we do an official change order. Um, it caused some problems, but I think if you are open and honest and consistent with the messaging up front, and let everyone know what the terms of the deal is going to be, folks typically, even begrudgingly, will go like, okay, yeah, sure, we're fine, because they're going to get some work done. Right. So that's how we kind of navigated that as much as possible. We also tried to make sure that homeowners understood that Action Housing was their recourse. Like, you don't contact Mark, your foreman. You contact Dan or Ian or Ella or somebody on the team, and we will address the problem, because the way the contract's written is they are not under contract with the contractor; they are under contract with Action Housing. So that gave us some, like, a little more merit, I guess, and push. But yeah, I mean, it's still to this day. I'm probably going to get a phone call at some point later today from someone who's mad at their contractor for not doing the floors like they wanted them to do. But if it's not in the scope, it's not in the scope, and you just stick with it. So.
Exactly. Well, thank you all. I have lots more questions I could ask, but since there are so many in the Q&A, I'd like to move to those, and I'm going to turn it over to you, Tony.
Thank you, Claudia. Yeah, there's a ton of really great questions, and I'm going to try to get to as many as I can. And so I think maybe this first one is suited well for Cypress and Sarah. A couple people are interested in the average cost of the home repairs, and relatedly, if the study determined which of those repairs were generating the most improvement in someone's well-being or quality of life.
That's a great question. The first piece is pretty straightforward to answer, which is, I think it ended up being about $46,000 per house. That's right, Dan? You're nodding. Yes.
Yeah.
And then
Yeah.
the second piece is, no, we weren't able to sort of determine that. I think, right, like partially it was a relatively small program, and we were doing interviews, and so that can be hard to get at sort of in that direction. I think also people don't tend to experience their homes in that way, right? Like your home is this sort of like holistic um place where you feel safe and um come back to, right? It's like the seat of so much of daily life. Something that we do hear and did hear, right, is that sort of when the really big repair issues got addressed, people suddenly felt more able to address smaller things and to like really like settle into their homes once there wasn't sort of like these major health and safety issues. Sarah, do you have anything to add there?
No, that was perfect.
Great, thank you. I think this next question is maybe geared more toward Dan. This member of the audience is asking how you determine if a home is like quote unquote too far gone to conduct repairs, and if there's a certain threshold or something you look at to make that determination.
Yeah, I mean, it's everyone on the team has been doing construction at Action Housing or some level for a while. So, we all have just like learned experiences that we're working on. We go in with an idea of what general code violations are going to be, and we know how much money the program can provide, right? This is why we stay so hyper focused on just those things that are about health and safety risks, right? What eventually happens is that you tour the house and you start looking at things and keeping in mind that like visually you're not going to catch 100% because there are the problems within the walls that you don't necessarily see, right? You get a lot of like weird wiring in Allegheny County where it looks like it's Romex, which is a more standard wiring, and then it jumps to knob and tube, but it's buried in the rafters and you can't see it, right? Basically, we just go into the house and take a look at it and a mental checklist of, hey, look, we have 50K here. If you're going to need a new roof, if your electrical system is really, really bad, if your doors and windows are also very bad, if you have a terrible furnace and hot water tank system, like all that adds up. At some point, we can't do all the work to save the house. It has to be a pretty severe code issue, though, right? The one that always I remember is literally there was a tree growing, a limb was growing through the house. Like it had busted a window or something, and because trees will go, they had a tree running through a second floor bedroom. I can't do anything about that. It did not have enough money. Overall, I probably only made that call about 4 or 5 times throughout the entirety of the program. That's where getting creative with stacking capital becomes really important. And we had some great partners throughout this, especially rebounding together Pittsburgh and Women for a Healthy Environment, who had some also like set aside funds to do some things. So we really worked with them to try to say, hey, this is going to be a $65,000 project. Do you have the 15? If we have the 50, because we can't leave the house in this condition. And that we did more of those than we did actually telling people that we couldn't work on it. So yeah, I hope that answers the question.
Definitely. I like that you're kind of bringing it back to the actual funding of the program. And I think that's something that people are really interested in. Several people asked about financing, and I think anyone can take this on this question. But can you all speak generally to where funding for this type of program came from? And more broadly, if the federal funding landscape right now will have an impact on this type of funding going forward?
I can't. I don't want to because it's not good. But this money came from the American Recovery Act. This was Biden administration ARPA money that went to the U.S. Treasury Department, and then the U.S. Treasury Department gave allocations to every state. The Commonwealth of Pennsylvania got 125 million, and then 64 of the 67 counties in Pennsylvania applied for funding, got money. Allegheny County got 12.9 million, but this was federal funding. The interesting thing is that this was a one-off we had never seen before. Most home repair programs that are federally funded come through HUD. It's under either community block grants or the home program. They are very rigid and very difficult to use, right? And there's never enough money to do anything at scale. So this was for every state almost. This was a real new experience with a lot of money on the table that we've never seen. Any mention of the whole home repair program died on January 1st of this year. Like, I know there was I'm not trying to play politics here. There was a bipartisan bill that was sitting at the Senate level. Part of my job, like today, is I do a lot of lobbying, for programs like this. That bill never had legs. There was no intention to it. It was just somebody trying to tell their constituents they're working hard for them. So we don't see this money coming back at the federal level unless there's dramatic changes in DC. States also aren't particularly good at this because they're also restricted to getting CDBG and home funds typically. Pennsylvania has a housing trust fund in which money is put in from taxes on gas drilling and an increase in property real estate transfer taxes, but it's not a lot of money. So yeah, I'm constantly trying to figure out who's got something that we can keep programs like this up and running, even at a much smaller scale. So but it does have to come from the federal level in most cases.
Yeah, we totally hear you in terms of the limited funding options there. And I think given what you're saying about these limited options, I wanted to follow up a little bit with Cypress, since your study found that homeowners tended to underestimate their repair needs. And since those needs are so great, as we just went over, um, are there ways that policymakers can better align the need with the cost? And, how can we go about this better at actually making ends meet?
Um, well, that's a really hard question, right? Because it's about sort of making trade-offs that are just sort of impossible to make. Um, I I have like that being said, I think that a lot of times it's a problem to solve at the local level, right? Depending on sort of exactly what the population that stands to benefit looks like. Like who are homeowners, right? Who are these low income homeowners who need help? Are they older folks? Are they younger folks? In which case, maybe there's models that could use sweat equity. Maybe there's models where like there's some financing, like low interest financing, alongside grants that get put into homes. Maybe there's a lot of braiding of funds. I know that Dan's team has done a lot of work to sort of like maintain this database so that they're able to sort of figure out who is already in their system who could stand to benefit from different funding sources. Am I doing that justice, Dan?
Yeah.
As money comes through, there's been some work in Philadelphia so that if someone's seeking home repairs, right, they're able to put together one application that goes out um, to all the nonprofits and city programs that they could potentially stand to benefit from, allowing those programs to coordinate better with one another. I'm not sure exactly where that project is in terms of getting rolled out. Um,
It's on their website, Cypress. I forget what it's called, but Philly, more than any other county in Pennsylvania, has got
yeah,
multiple capital stacks. And I
yeah.
mean, shout out to my brothers and sisters in Philadelphia. I love you guys. They did a great job. Absolutely fantastic job.
Yeah. Right. And so that's some of those people are putting in applications to things, yeah, like Rebuilding Together or Habitat, who are then, right, sometimes in turn getting whole homes money, but also have other funding sources and are able to sort of do a lot of that braiding work. I think another thing that we saw that a lot of times, right? Action Housing, and Dan, please correct me if I'm wrong, your team needed to spend time doing project management with a contractor, and there was a GC on a project doing contract management. Because of how this funding was structured, it's totally unfeasible for you folks to have built out a team internally to be doing repairs. Habitat for Humanity in Philadelphia, though, has been able, they do repairs, but because they also do new construction, they have internal teams. And so they're not doing as much of this like double project management, which can cut down on the administrative costs. Um, and then the one last thing I'll say is that housing and housing repair needs looks different in different places, right? In Philadelphia, there's a lot of row homes. Those homes have unique problems. And so I think also thinking through and being really intentional about exactly what the housing stock looks like in different places is probably another way where one could find efficiencies.
Yeah, absolutely. Thank you for sharing. I think we have time for maybe one final question. And I think anyone can answer this one. I'm really interested in how a home repair program like this one or a similar program can guard against displacement and fit into broader conversations about housing equity.
It's 2 cents. Yeah, it's I mean that's what these programs are. These programs are about housing preservation. Right? Like the best house for someone to stay in usually is the one they're currently in, right? And so these programs, I think, um, are really, really, really important for this kind of housing preservation. Like nationally on foreclosure, you don't see the displacement as much because foreclosure rates are still relatively low, all things considered. And most mortgage companies since the foreclosure crisis have systems internally that will help people out. There is not a lot of tools for an individual who can't get a loan, can't dip into equity, and their house is falling apart or killing them, right? And there's not enough affordable rentals, at least in Allegheny County, to move those folks. So these programs are vitally important in terms of trying to keep people in the communities that they call home, that they're where they want to be. We are starting to see that legislators are understanding that now. It is kind of curious to me why they didn't before, possibly, but um, yeah, and it works well because we can have these conversations also with like rental eviction teams when we like collaboratively go for money now because we can do a whole like you got a home repair program and you got a rent rebate program to help tenants and stuff like that. So it's more of a holistic approach of from both the homeowners to the renter side. Let's just keep everyone in the place that they want to stay in.
Well, thank you all. That was a perfect way to end a really rich conversation. This topic is near and dear to the lab's heart, so I hope those listening today will continue to engage with us. Thank you one more time to our fabulous panelists. We're so grateful. And thank you for everyone who attended. All right. Bye.